Hello, it's Rockson Liu again from Emeryville, California, dedicated hernia surgeon. So today I want to talk about recovery. So of course that's a very common question, and I spend a lot of time talking to patients about recovery. Of course, a 20-year-old gymnast is going to recover very differently from a 80-year-old retired patient, right? So the recovery is different for every patient. So in this video, I'm not going to be able to cover every specific instance, but I can talk about the generalized recovery. I'll break it down into inguinal hernias and small ventral hernias and complex incisional hernias. So with inguinal hernias, with robotic surgery, I've mentioned this in a previous blog post, but I will go into a little bit more detail. So with a inguinal hernia repair done robotically, again, I am not worried about that hernia coming back after about 12 hours, 24 hours, because that mesh is going to be locked in with good technique, good mesh overlap. That mesh is not going anywhere. Okay, so what you're going to experience in the first 24 hours is soreness, and most patients who have gone through this surgery say that the soreness is more like what you feel after a very extensive workout. Okay, not like being stabbed with three very sharp objects, but more like just the burning, achy, stiffness, tightness that you would experience a day after a very extensive workout. My partner who had surgery said it felt like he had done 1,000 sit-ups. Another patient said 500 sit-ups. And most patients who don't want to take any narcotics don't need narcotics at all. I've not found a patient who has told me they don't want narcotics and required narcotics after surgery. Okay. And then after 2 days, so during those 2 days, because you're going to feel really sore and stiff, just like after an extensive workout, you're probably not going to feel like doing too much, right? So I tell folks, walk around the house. You can, walk outside the house into the yard. If you want to go out and somebody is driving you, that's fine. But don't do too much. Just be ready to take lots of breaks, lots of rest. You're probably going to want to take some naps. And Tylenol and ibuprofen is usually adequate. In terms of food, because of the general anesthesia and me being in your belly, your intestines will be a little sluggish. So eat small meals, nothing too greasy, nothing too spicy, just light meals. It doesn't have to be liquid. It could be solid food, but just on the lighter side and smaller meals until your digestion kind of recovers. Some people get a little nauseated with anesthesia. So no alcohol or anything that's too stimulating, not too much caffeine. You can have some coffee, but not too much of it. Bowel movements may take a few days to come. That's why I give stool softeners and laxatives so that when you do have your first bowel movement, it's not hard and you don't get constipated. Because we're working down in the pelvis, urination may be a little slow, especially in older male patients with enlarged prostate. It's really rare with good robotic surgery that's very precise and gentle to require a catheter. That wasn't the case with laparoscopic surgery, which involves more tearing and a little bit more trauma. So I don't use a catheter at the time of surgery because my operations are very fast. So no catheter is needed. And then it's very rarely, maybe once a year, does a male patient need to have a catheter inserted because they can't urinate. And then the third and fourth day is when you start turning the corner. I have a lot of professionals who have surgery on Friday and go back to work on Monday. Maybe half a day on Monday and the full day on Tuesday. My partner who had surgery on Tuesday actually took call and did surgeries on Thursday. So the recovery is not too difficult. Now, everybody's recovery is a little different. So even though you're able to go back to work, there's still going to be some soreness and sensitivity in the incisions and the groin area. And I tell patients to use pain as their guide. So if you're doing something and it doesn't hurt, it probably means it's okay. If you're doing something and it hurts more, it probably means you're overdoing it. I've had patients, start jogging after 3 or 4 days. I've had patients start swimming after about a week. And it could be pretty extreme. I've had patients who go skiing, a couple weeks after surgery. But in general, I don't recommend doing anything abrupt or sudden. You want to be in control of your body for about 3 weeks, where if it hurts, you stop, right? It's not no pain, no gain. You definitely don't want to push through the pain, because the pain is your body's way of saying that it's healing, and you're pushing. You're pushing it, and you're overdoing it, and you're going to cause more inflammation, which may set you back. I've had some patients who kind of disregarded my recommendations and went and played basketball, got knocked over, and they were in severe pain, and the pain lasted much longer than it should have, probably because you're adding inflammation on top of inflammation. And then people always say, ask the question, how long does recovery take? The endpoint is different, right? An 80-year-old gentleman maybe just wants to walk. Well, he can walk almost right away, right? And walk pretty well after a few days. But for a 20-year-old, just walking is not the endpoint. They want to be able to play basketball. They want to go skiing. They want to do, very physical activities. And I would say to get back to extremely physical activities, it's going to be anywhere from 3 to 6 weeks. Again, I don't put any restrictions on what you do. If you want to weight lift, gradually start with just the movement. Then you add slight weights and then go up a little bit on the weight, go up a little bit on the intensity. You want to go biking. Well, start with a stationary bike so you don't actually fall over, right? And then once you feel stable enough, then you go out on the road or on the trail. Pick easy routes where you're not pushing yourself too hard. You're just biking. And then you gradually push yourself more and more, right? All the while you're doing activities where you're in control, so if it hurts, you stop, right? And then, if it's sensitive and sore, that means your body's taking a little longer to recover. And so just listen to your body. So that's an inguinal hernia. For like an umbilical hernia or small ventral hernia, the recovery is a little different. It takes a little longer. Maybe it's a little bit more painful, and more people need narcotics, even though it's a small incision. And the restrictions are very different. With an inguinal hernia repair, I'm really not worried about the hernia coming back. But for an umbilical hernia repair, regardless of how I do it, there is a chance that it could recur. And so I have people take it more easy, especially with suture repair, right? The repair is relying on the suture, and if it tears through, then the hole's going to come back if there's no mesh behind it. So the small umbilical hernia, I usually tell people to wait 4 to 6 weeks before straining the abdominal wall. So not too much twisting, not too much stretching, and then lifting probably 15 pounds. If you're petite, maybe 25 pounds if you're very muscular and used to lifting weights. So that's the kind of umbilical hernia. When it comes to a big incisional hernia or complex surgery, then the recovery really is very variable, and it's hard for me to say online, what your situation is going to be like. But it's not going to be the same as inguinal hernia and umbilical hernia. But I can tell you, if you have a robotic repair, your recovery is going to be faster than if you have an open repair when it comes to a complex hernia. I typically have patients leave the hospital either the same day after complex robotic hernia surgery, or stay 1 or 2 nights in the hospital. That's pretty common. Okay, staying 5 nights a week is pretty rare for a robotic, even the most complex hernia repair. So that hopefully gives you a little sense for what recovery is like. If you have individual questions, you can definitely make an appointment to see me, and I'll be glad to give you more details. All right, take care.